The mortality burden of aortic stenosis still remains a big issue. Up to 40% of the patients with severe aortic stenosis remain untreated at 4 years. Those delays in treatment will lead to increased mortality in those patients. 1 out of 10 patients will die within 5 weeks of awaiting treatment.
So we know once a patient is diagnosed with severe aortic stenosis, it's incredibly important to get them referred to a valve specialist. We know that delays in referrals for these patients can lead to worse outcomes. They can have decreased survival, increased rates of heart failure hospitalizations, and increased rates of myocardial infarction. So it's incredibly important to ensure that these patients don't fall through the cracks. And yet we know that they do. Studies have shown that only 51% of patients are actually referred appropriately to a valve center once they're diagnosed with aortic stenosis. So that means that 49% of patients aren't getting the proper care. And it's an incredibly important thing because not only do patients get evaluated for aortic valve replacement, they're evaluated by a multidisciplinary team that includes an interventional cardiologist, echocardiographers, cardiac surgeons, and that really allows for patients to get really a full spectrum of care. If you have a patient who has severe aortic stenosis, please get them referred immediately to a valve specialist and a multidisciplinary heart team. This will end up being good for your patient, both in terms of their survival, but also for their quality of life.
Given the increased mortality burden of aortic stenosis, I believe it's extremely important to refer promptly to a valve center and a center of excellence where a heart team will assess the patient together and decide either surgery or TAVI is the best option and respect the need of the patient and the desire of the patient.